Hi, I'm Dr. Karen Becker, and I have a great guest today. I have Suzanne Valente, who is a retired dentist in the San Francisco Bay Area, and she has put together a really awesome website called healthyandhappydog.wordpress.com. And so thank you so much, Suzanne, for joining me. And let's get right into it. How did you put together this awesome website? I know that there's the story about how it came together on the website, but I think it's very inspirational for our listeners and readers to learn a little bit more from your heart and directly from your mouth as to how this website came about.
Well, hi, Dr. Becker. I'm so happy to be with you and your audience today and hopefully give them some information that will be helpful to them. We started researching things. I had a dog named Billy who was just the most frightened, sweet little guy. And he had so many health problems. He had behavior problems. He had orthopedic problems. He had diabetes. He had, metabolic problems. And we just loved him and we wanted so badly to take care of him, but we had so little guidance. We were like, going from one crisis to the next. And so we did a lot of research and we learned a lot about what happened. And we discovered that his being neutered had caused most of his problems. And so we recognize that other guardians of pets out there and dogs really want to take good care of their dog too. And so maybe the information we learned, we could pass on to them.
Yeah, absolutely. And when did you launch the site? How long ago?
Oh, very recently. We've been researching since probably 2012 when Billy first developed diabetes. And the information just kept snowballing. And he passed last November and we decided, that might be a good ode to him to put together the website and get it out in his honor.
Yeah, well, sure. And just as you, are moved to tears, I most certainly have been down that path of unknowingly recommending traditional spays and neuters, of course, and we've all kind of learned the hard way that we can sterilize animals without having to destroy their endocrine systems. But it's something that I feel like we almost have to learn one by one. Veterinarians as a profession aren't changing their recommendations, so we end up almost doing this grassroots effort in helping people understand what's going on. One of the things I love about your website is is the depth and breadth of information that you've provided. And one of the comments or questions I get regularly is, I think in a lot of people's minds, they think, well, I've had a hysterectomy myself, and so it's, other than maybe gaining weight and having some skin and hair changes, what else really could animals be experiencing? And what people don't realize is that ovariohysterectomy, taking the ovaries, the endocrine producing tissues out of female dogs, or the testicles out of male dogs, it's very, very different than just removing a human uterus. And so talk about, as you were collecting all of the data that you've put on your site, what are some of the more common, or even people that are emailing you, what are some of the more common symptoms that you're finding people want knowledge about when it comes to their dogs that have been spayed or neutered? What are the more common symptoms that people want to talk about or are researching your site to learn about?
Well, see, the thing is, with hysterectomy and vasectomy in males or humans, usually it's done later in life. And one of the big issues is they're proposing spay-neuter, early spay-neuter, when dogs are less than 6 months old a lot of times. And what people fail to understand is that you're removing sex hormones from the dog's body at a time when they are still developing. And that can affect their brain, their orthopedics, how their bones and everything develop. And that's the critical thing in many respects, is that it's different in dogs than it is in humans because we're doing it so much earlier at a time when it's totally unnatural. A lot of women go through menopause. At that point in their life, maybe it is natural for the sex hormones to be diminished, but not when they're a young baby, which is exactly what we're doing. And some of the warning things, it can get very complicated, and we try to really lay out a spectrum of scenarios for people who've already had a spayed or neutered dog, and they're saying, what can I possibly do? So the reason I mentioned the orthopedic is because that's a developmental issue where if they spayed or neutered them really early, there's nothing you can do to deal with that except, like try and do repairs, In other words, if they have hip dysplasia, they have hip replacement surgery, or if they have torn ligaments in their knees, they get TPLO surgery. But some of the metabolic issues you can do something about. And what we try and do is give people enough guidelines to start watching their dog. Like if they start to have a problem where their vet says, I think your dog is hypothyroid, that probably means that in the males, there's not enough testosterone, and the females, not enough estrogen, because sometimes if you fix the estrogen testosterone problem, the thyroid will come back to normal. But it's a red flag for you to know that my dog needs some attention now, and we need to check their hormones all the way across. The other thing for female dogs is when if sometimes they become incontinent, even at a fairly young age, that's usually an estrogen deficiency. So that's another red flag where someone could go into the vet, and instead of just getting a drug to help them not be incontinent, they could hopefully look at their hormones and see, oh, maybe we need to be giving my dog some estrogen.
Yeah, and it's interesting. Hormone replacement therapy is something that most veterinarians don't do. There certainly are functional medicine docs in veterinary medicine, and I am one of those doctors that am a huge believer in physiologic replacement of natural sex hormones. However, you and I both believe the same thing, that you would never automatically prescribe physiologic hormone replacement without checking those values. So talk a little bit about if people have a spayed or neuter dog and they believe that the spay or neuter has negatively affected them. What do you talk about on your website about first and second steps in terms of determining how bad the damage has been, and then of course formulating a plan, then a damage control plan for what you can do going forward?
Yeah, and also another key thing is behavior. Billy was very fearful from day one, and he probably always had hormone imbalance that couldn't be corrected. I don't know. We didn't try, obviously, at a young age. But so that's another clue for people. But you take it through different stages and try and sometimes people can use, like say your dog's behavior is really anxiety. Sometimes what you can do, if you want to, you can do their hormone check, but there's other things you can do. Like I know that some dogs take SAMe, and that can have a major improvement in their behavior because it sort of mimics certain hormones in the brain. And the problem that you're always dealing with is that just adding another hormone back in does not put you back to square one. It's never going to be right, but you do the best you can. So in terms of dogs with behavior problems, sometimes we go with, like I say, SAMe, or when you have a female dog, they have the ability to make estrogen in other parts of their body, not just their uterus and, well, not even uterus, their ovaries. Their brain makes a lot of estrogen, fatty tissue makes a lot of estrogen, and sometimes you find that you can supplement them with something different called like DHEA, which is the same thing occurs in humans. Sometimes when people have what we call adrenal fatigue or whatever, or basically the dog is not able to make enough estrogen on its own, then you can supplement with things other than estrogen and allow their body to take up the slack. I'm kind of explaining this poorly, but basically the thing that's so difficult is when you first do a spay or neuter, you're removing the sex hormones. However, their adrenal glands on young dogs can compensate. And they compensate some dogs fully for a period of time, other dogs never enough. But it depends on the individual dog.
Yeah.
But the idea is if you can catch the point in time where their adrenal glands are no longer able to compensate, then you can start doing other things to help. And one of them, like in female dogs, is sometimes there's a substance made in the adrenal gland called DHEA. That's a precursor to estrogen. If you supplement them with DHEA, their own brain or fatty tissue or whatever can start making estrogen, and you may need to do no more for them. Because as you know, when you go to hormone replacement therapy, there's always a big issue of, is it natural hormones that you're replacing, People are afraid of synthetic hormones. In humans, it's much more.
Yeah, rightfully so. Yeah, for sure. Yeah. Now, the other thing that you touched on that I see regularly in practice is animals who actually overcompensate and produce quite a bit of estradiol. So one of the main reasons that we always suggest that if you think that your animal's having some hormone imbalance post spay neuter, absolutely could be so, but sometimes there can be an excess of estradiol that actually you have to work for the rest of the animal's life at controlling. So in those situations, measuring the amount of hormones that your dog is or isn't producing is really important. So estradiol, high estradiol, is a very common issue even among male dogs, and I think you experienced that as well.
Yes, Billy had 6 times the normal amount of estradiol for a male dog, and no testosterone. So the thing that was interesting about Billy too, and I do have, research in my background, my undergraduate degree in genetics. When you want to graduate with honors, you do research projects. And when I retired from dentistry, I was involved in some research projects here at the Dental Society. So what you realize is sometimes when you have an animal that shows the extremes, you can learn so much more than just the day-to-day problems that come along. Billy was a drastic extreme, no testosterone, 6 times the amount of estradiol. And he became diabetic as well, and that's sort of how we put it all together, recognizing that his diabetes actually was due in large part to the hormone imbalance. And we found that nothing would help his diabetes. We couldn't control it with insulin injections and monitoring his diet and exercise and all that. We actually had only improvement when we started removing the estradiol from his body and supplementing with testosterone. Then we were able to get his diabetes into a manageable state, but it took us years because we just didn't know initially that would be the way we should be proceeding.
Well, and also you ended up having to be very much your dog's not only own advocate, but you had to navigate this on your own. There's not a veterinary endocrinologic society that talks about balancing hormones post spay neuter. Sadly, we're just not there yet. So the information that you put together on your website does a really nice job of kind of compiling all of the current research into one site so pet owners can go and get the information that they need, because really there's so many diversified symptoms. You touched on behavior, and behavior is a big component that we can see shift post desexing. So interestingly, you're a new site, but I can only imagine that you've had some feedback, I'm sure a lot of positive feedback, but some feedback with people saying, I'm nervous about you potentially, and the website potentially feeding an additional increase of dogs going into the shelter system. And you and I have the same opinion on that.
Yeah, well, I think that the issue, you're balancing several things. On one hand, people are very, very concerned about pet overpopulation. And that's why I think it's so important to emphasize to people that you should be asking your veterinarian to do a tubal ligation or a vasectomy. That is not an irresponsible decision in terms of pet overpopulation. It's an entirely responsible decision. And so I think that's number one. Number two, spay neuter and the hormone dysfunction does affect behavior. And in doing so, I think sometimes dogs end up in shelters or euthanized for that very reason. And Billy is a perfect example. Billy came out of the Sacramento shelter in California, and that shelter has a reputation of euthanizing a lot of dogs. And those that they don't euthanize, a lot of them they send over to UC Davis for testing and then euthanization, which I find very uncomfortable. But to move on, at any rate, Billy was slated to be euthanized because he was too fearful. And I always thought that dogs in shelters were there because they were aggressive. And what I'm finding over the years learning is that a lot of dogs are fearful, and the fear is what brings on the aggression. And because of their problems, they are returned to a shelter or not able to be adopted, and then they are euthanized. And I actually think that if we did, instead of spay neuter, do tubal ligation and vasectomy, then you are not going to be contributing to pet overpopulation. And I actually think you will be benefiting dogs behaviorally to the point where fewer of them would find themselves in shelters in the first place. So that is an argument that I expected to be used, and I actually haven't had too much. So
good.
I'm expecting that people would, what we did is we set up this website and tried to document it so thoroughly that if someone had issues with what we were presenting, they would see over 100 peer-reviewed studies to show that this isn't just something that, you know, that somebody decided to put together because they felt bad about their dog. This is something that we really tried to present knowledge that's reliable, credible, and peer-reviewed and legitimate, so that somebody can rely on it.
Well, and the great thing about the site is that instead of having to go here for one site or here, you know, go to a different website to collect 2 or 3 other pieces of material, you've cohesively put them together, which is really nice. People can just visit healthyandhappydog.wordpress.com and have all of those research papers together in one place. As a side note, for those of you watching, many of you know that I advocate the ovary sparing spay, and one of the reasons I'm suggesting that technique in addition is that veterinarians, none of us learned about how to do a tubal ligation during vet school, but we did learn how to remove ovaries and uterus. And in essence, even if veterinarians have never done an alternative spay technique, removing the uterus is a part of a traditional spay technique that could be very easily modified to just leave the ovaries and remove the uterus, and you have a hormonally intact female that is not capable of reproducing, but still has those really important hormones that provide immunoprotective effects, as well as improvements, of course, with longevity, behavior, and a much more natural physiologic state endocrinologically. So tubal ligation is absolutely a great technique, but veterinarians don't know how to do it. So we'll add in that third technique for veterinarians that could easily modify their current surgical skills to be able to offer this to clients. Have you had people have a hard time finding veterinarians that will modify surgical techniques?
Yes and no. I mean, I find it kind of disturbing that the veterinary schools, even for current students, are not dealing with tubal ligation or vasectomy. Because it's so sensible, you kind of wonder, why isn't this happening? But there are reputable surgeons around the Bay Area. They're starting to come around where you can find someone like our regular vet does just spay and neuter. He doesn't even do that now. But he has a specialty surgeon who comes into the office to do certain procedures. And he asked his specialty surgeon, he says, you know, I'm starting to get recommendations or requests for that procedure like a vasectomy. He says, so I just sort of study up, and it's a simpler procedure anyway in many respects. And he says, it's no problem, I can do it, you know. So I think that there are veterinarians out there, but it's by no means the majority. And the other problem I think you have with veterinarians is their lack of comfort with this idea of supplementing hormones. I mean, I know we had a very difficult time. Well, we went to a specialist. Our vet referred us to a specialist in terms of Billy's diabetes, and I was able to get her to prescribe anastrozole, which is a very strong estradiol inhibitor, and that worked very well for Billy. It brought his blood sugars or his blood glucose down from maybe 400s to 300s, and the specialist was willing to prescribe that. And a lot of times other people are recommended to take melatonin. I'm not so hot on that idea. It's on our website, a long explanation as to why melatonin may not be the best choice to get rid of some of the estrogens. But she would not prescribe testosterone at all. And our family vet finally did, our primary care vet, because he said he knew Billy was dying at 300 glucose all day, every day. That's, you know, this is terrible. So when he did do that, the funny thing is Billy's behavior was much improved. Mm-hmm. And his fears of things that you wouldn't expect. Like, for example, we worked with him, and a lot of people coming to this site understand when you get a fearful dog or whatever, it's really a process to try and socialize them and get them to lose some of their fears, and it can work. We made a lot of progress with Billy, but things like fireworks, lightning, thunder, I mean, you know, you try and desensitize them, but we had very little success. Testosterone supplementation. We had fireworks like crazy. He could hear them. He would turn and look, you know, trying to figure out where that noise was coming from. but he was actually relaxed. I mean, this is a dog that used to be underneath the stairs, inside a closet, with blankets and a radio playing to try and distract him from whatever bits of fireworks he might be able to hear, and he would still be shaking. You would sedate him and he was shaking. I mean, we went to such extreme measures to try and help him deal with things like fireworks, and it was just totally not working. Testosterone, hey, whatever. So it can be dramatic, and that's one of the things you have to work that's hard is getting either veterinarians to do tubal ligation or vasectomy, because as you say, they're not necessarily familiar with those, but a good surgeon can do this. And the other thing is getting the veterinarians on board in terms of trying to rebalance hormones. And you're right, because the estradiol going up, that's why I say it's not just hormone supplementation, it's really hormone balancing, because you do sometimes have to remove excess hormones, and that's difficult sometimes.
And you bring up a really great point when it comes to testosterone. Many of you listening may think, oh, I can't believe that adding testosterone could actually chill out an anxious or nervous dog. But you have to remember, we're not talking about overdosing testosterone or putting in huge amounts of synthetic hormones. We're talking about physiologic doses of putting back into the body what naturally would have been there if you had not castrated that dog. So it's interesting. We know that these sex hormones play into cognitive brain health and brain neurotransmitter production and brain chemistry and physiology to a very profound measure. And when we remove these hormones, it throws off the entire endocrine balance as well as cascade. So you absolutely can have mental disorders and a lot of behavioral issues secondary to hormone deficits. So that's something that veterinarians, we know that that's true with thyroid, but we're beginning as a community to recognize the importance of sex hormones playing into behavior issues as well. So, and you saw that play out, and I have seen that play out in clinical practice time and time again, that when you rebalance hormones, you can see a dog's entire demeanor and personality change, not to mention improving overall physiologic health and potentially ward off some of these secondary degenerative diseases such as diabetes, type 2 diabetes, that unfortunately can come about.
There's one other thing I want to point out that I didn't get into earlier that is really helpful to people to understand all of this, I think. And it's this issue of endocrine disruptors. This is something that I feel like when people go in to talk to their veterinarian, it's hard to explain something like this. It's a complicated thing, and you feel like you're at a loss in terms of countering any discussions that you have where they say, no, you really need to do this. And yes, the veterinary community has been slow to acknowledge, they're starting to acknowledge in their studies the orthopedic issues and the behavior issues, but the actual metabolic issues like diabetes, Cushing's, hyperestrogenism, I am absolutely confident that those are due to spay neuter, but there isn't tests or there isn't studies out there that the veterinary community is doing to really link those two. And I think that one of the things that I found that was very interesting is that Banfield has that large group of clinics that go all the way across the United States. They're reporting like an 80% increase in diabetes in the last 10 years in dogs. And the easiest way that I have found to explain this type of thing is through the study of something called endocrine disruptors. And it rings a bell for people because we are told in what we're discussing, you and I, is that, the lack of sex hormones causes a spectrum of things, behavior problems, it causes neurological problems, it causes orthopedic problems. When we get to the diabetes, that's sort of more of a theoretical type thing or a clinical experience type thing, except for one aspect of it. I realized in my profession, we hear a lot about endocrine disruptors, and people don't really know what an endocrine disruptor is. What they'd be shocked to find out is these are things like DDT, BPA, dioxins, PFOIA. These are PFOA. But chemicals that we know are very dangerous to humans and wildlife, and there are studies about those. What people don't realize is these dangerous chemicals that we go to great lengths to avoid are actually working by the same mechanism spay-neuter does. In other words, both of them block or mimic sex hormones. That's how they operate. So then when you look at the human and wildlife studies for endocrine disruptors, you see this whole spectrum of things that you are talking about and I am talking about, which is like diabetes, hyperestrogenism, or cancer.
Thyroid as well, yep.
Yeah, and a great increase in the amount of cancer, certain types of cancer, problems with immune systems. So, I mean, the endocrine disruptor, when you understand that you're talking about the equivalent of subjecting your dog to DDT or your children to BPA, those are the kind of changes that are actually occurring in your dog's body when you spay or neuter them. And that, I think, helps people to really fully understand how this problem, this change in their endocrine system, as you described, changes everything. It affects all parts of their body in ways that we don't yet even understand. I mean, in my journal, just this month for American Dental Association and California Dental Association, one journal has an article about endocrine disruptors, and it's talking about how they're learning that in studies of rats, and they're bringing it over to humans, that a lack of estrogen or testosterone can cause a failure to have tooth enamel develop appropriately. So, I mean, what we're seeing is this affects things we never even dreamed of.
Right.
And that's why it's so much easier to contemplate trying to do these things with a respect for the hormones that they should have. In other words, tubal ligation, vasectomy, or removing the uterus. This will create, it'll help a lot of problems, and some probably that we don't even anticipate. It's much easier to approach the problem that way than it is to continue spay neuter and try and clean up the problems as they occur.
Absolutely, and I couldn't agree with you more. So doing damage control, all of us have had spayed and neutered animals. Doing damage control is maintenance for the rest of that dog's life, and we fall very short from what the body would naturally be producing. So it seems very wise and very rooted in common sense that we would simply make better choices going forward with different surgical techniques. Absolutely. And you actually bring up a really great point about endocrine disruptors. On top of this spay-neuter effects that blatantly take away all sex-producing hormones in a dog's body, we have those chemical disruptors in the environment. So, you know, our dogs and cats are sleeping on flame-retardant sprayed dog beds. They're drinking fluoridated and chlorinated water. They're walking through pesticide-sprayed grass. So on top of the desexing aspect creating that, they actually have additional chemical insults. So they kind of have a double whammy going forward. They're actually, they have substantially more hormone problems than probably humans. We just have never investigated it.
Yeah, exactly. I mean, that's exactly what I thought. Double whammy. They're getting it from all sides, and it's like it's enough for your body to try and compensate for the environmental abuses of endocrine disruptors, not to mention already creating them from the very start.
Right. So through your heartache, Dr. Valente, you have been able to channel your heartache into a beautiful gift that will give to other pet owners, hopefully to be able to make some, armed with good information, be able to make good decisions before their pets degenerate to the point that there isn't hope. And it's really just refreshing for me to see pet parents like yourself really dive in and take a hold of an issue that they feel passionate about, and that's exactly what you've done. And so I commend you for doing that. I'm going to encourage everyone to go and look at Dr. Valente's site, and we really appreciate you today taking a few minutes to explain the hows and whys of your site. So thank you so much.
Oh, thank you.